So hello guys, today we are going to deal the topic sputum. So sputum is very important when it comes to the clinical examination, especially in respiratory cases. So the topic will be deal under following headings: introduction, types, and clinical application. So generally, let's give a definition of sputum. So what does sputum mean? Sputum is a type of mucus that is secreted by cells in the lower airways of the respiratory tract. So why is this mucus produced? This mucus consists of two portions, that is mucin and the protein. So what does this mucin do? The mucin protects the delicate tissue of these sensitive areas of lungs, and this mucus helps trap and remove the small particles of foreign matter. So the mucin serves to a protective function, but once there is an infection or any other underlying cause, there will be excess mucus production, which will be secreted as a sputum. So the mucin is produced by the goblet cells that line the airway and contains immune cells to fight off the bacteria, and it also helps the cilia to trap and remove foreign substance. The normal production of the mucin is about 100 ml each day, which is transferred oropharynx and is generally swallowed. So what is important of sputum, especially in the clinics? So the sputum, when dealing generally, we can classify the sputum on the following headings: the color, the quantity, the odor, etc. So here are the few examples of what the color of sputum looks like. So a clear sputum is generally produced in chronic conditions like bronchitis and chronic obstructive pulmonary disease. When it comes to yellow sputum, it signifies inflammation and an underlying infection. So the yellow color is due to the granules released from the neutrophils, especially live neutrophils. The green sputum denotes the dead neutrophils, especially the lyse neutrophils release a green pigmented enzyme called veridoperoxidase. So the patients who are having a stagnation of neutrophils, these neutrophils undergo lyse and produces this enzyme, which produces a green sputum. Rusty sputum can occur in the pneumococcal pneumonia because lysis of RBC can occur, and hemolysis is the production of sputum with blood, which will be dealt later. So here we have a general classification: serous mucus purulent. Purulent means pus containing, and we can see that it is classified into clear watery, frothy pink, clear grey, white viscid, etc. So what does amount significance? An high amount of sputum is produced in conditions like bronchiectasis. Here there is suddenly we cough up a large amount of purulent sputum on a single occasion, which usually signifies the rupture of a lung abscess or empyema. A large amount of water sputum associated with pink tinge generally indicates pulmonary edema. Bronchiectasis is a condition which is defined by widening of bronchial airway system and weakening of the mucociliary transport system. Odor: foul smelling or smelling sputum suggests anaerobic bacterial infection. The anaerobic bacteria, when they undergo metabolism on the metabolic nutrients such as carbohydrates, generate sulfhydryl compounds and incomplete metabolites. These sulfhydryl compounds have got a specific odor, especially called as rotten smell. So when there is a specific odor, it generally indicates an anaerobic infection. So how we do collect the sputum? We should generally rinse the mouth to clear off the natural bacteria that is present in the mouth, and we collect this sample. We can use a sample to detect antimicrobial sensitivity testing, and drugs can be prescribed, or we can undergo cytology, microscopy, etc. So sputum is a mechanism of the body to clear and heal damage to the airways. But whenever there is an excessive trouble from the sputum, and when there is an sputum is especially have got a color streaks, especially red, blood tinged, you should definitely meet in healthcare.